one's body. You may have diabetes, but you don't know how much it is harming you, harming your health coming up. So, you know, when you have blood sugar level between 3.88 to 5.6, that's quite normal. But within this range, there's pre-diabetes. If you have blood sugar level between 5.3 to 5.6, it's not pre-diabetes, but it is pre-diabetes. And when is it pre-diabetes? If it is between 5.7 and 6.9 or 7. But one thing is important: if you have 75 grams of sugar, and after 2 hours, if you measure your blood sugar level, and if it doesn't cross 11, then it's pre-diabetes. But if it crosses 11, that is 11.1 or plus, you have definitely got the metabolic syndrome diabetes. So, two ways it's been measured. You have sugar, that is 75 grams, and then after 2 hours interval, if you measure, right? There's another way you can also measure your glucose level, that is average, right? The average blood sugar of 3 months or 4 months, usually 3 months. That is called hemoglobin A, HbA1c. It's measured. So sugar is glycated with hemoglobin. That's even better if you measure it, and if it is uh, less than 5.7, then everything is fine. But it's better to have less than 5.3. If it is between 5.3 and 5.6, it means pre-diabetes. And if it is 5.7 and 6.4, it's pre-diabetes. And if it is 6.5 or more, that's diabetes. And you have also levels. If you have 6.1 or plus, it means your body is harmed. Diabetes is harming your body. So if it is 7, it harms more. If it is 10, it harms more. If it is 20, it harms more. If it is 45, it harms much more, right? So the last part, that is cosmo right? So glycemia, uh, that is so much high. It's more than 30.3, right? So what you understand now is that if it is 6.1 plus, it keeps harming your body. The more harm. So it is better to have less than 5.7. If it goes higher, then it should not cross 6.1, because as long as you have 6.1 or plus, it's harming your body. So once again, I go about the details. If it is between 3.88 and 5.6, you don't have diabetes. If it is 5.7 and 6.9 or 7, you have pre-diabetes. And if you have more than 7, that is diabetes. So this is one way. This is random blood sugar level, RBC, random RBS, random blood sugar. And if you measure it by average, that is for 3 months average or 4 months average, mostly 3 months average, you have to test hemoglobin, HB, hemoglobin A1C. This is a little expensive, but you can get the overall picture of your diabetes. So diabetes is not a disease, it is metabolic syndrome. If your body cannot regulate blood sugar, it really develops diabetes. Right. So, how you raise your blood sugar level if you have insulin resistance? This is very bad. Insulin resistance is the main culprit of diabetes type 2. There's also another diabetes, that is type 1. It is actually autoimmune disease. Autoimmune disease means the immune system makes a mistake, attacks pancreas. There is beta cells. When beta cells are affected, you do not have, insulin. So the problem is, in the past, it is thought that if you have type 1 diabetes, it means you do not generate any insulin. But recent studies say that 20% uh, 20% uh, insulin is produced by your pancreas. But it's very little. So when you have type 1 diabetes, you cannot but you have to have insulin. But in case of diabetes 2, type 2, you don't need to have insulin. All you have to do is to have as little carbohydrate as possible, as little sugar as possible, as little glucose as it is possible, right? So type 1 is more dangerous. Out of 300 people, one person suffers from type 1 diabetes, but so many people suffer from type 2 diabetes. This is very common. Another diabetes is gestational diabetes. A woman gets pregnant, and after 3 months or in course of time, she may have diabetes. That is, blood sugar level goes even more than 7, right? And this is gestational diabetes. It's not a permanent case. After the delivery, after the childbirth, she will get rid of diabetes, the metabolic syndrome. But it is still a problem because she will have pre-diabetes. This is a problem. So if you do not take care of it, then in course of time you can easily get diabetes, right? Another diabetes, what I find is that when someone is sick, the metabolic system doesn't work, there's compromise, so blood sugar level doesn't go down. And if you measure, you'll find that you're suffering from diabetes, but you are not suffering from diabetes because of some disease, right? The body is busy to take care of the disease. There may be inflammation, there may be something wrong severely, then the body is trying hard to get it fixed. So the body doesn't metabolize blood sugar level, doesn't control blood sugar level at that point. I have found my sister, she had little problem with thyroid. She had hypothyroidism, and what happened is that she had diabetes little high, even she had less than 3 point, right? And sometimes high. So it's all because she doesn't have diabetes. After some months she has been diagnosed and she's having no diabetes anymore. It's all because she had some disease, some inflammation, urine infection, like that. And that's why the metabolic system doesn't that much work properly. That's why she had diabetes. So when you tested her, you'll find that she has diabetic syndrome, but actually she doesn't have. So it happens. So what can you do to alleviate from diabetes? The number one thing is that you do not take carbohydrate. The foods that contain carbohydrate you should not take: rice, bread, potato, uh, right? The fruits, fruit juice, right? Okay, so how we can control, and another thing is that you have to have move body movement exercises. I don't recommend exercise. What I recommend is that you watch YouTube videos and you keep on walking as long as you have telephone conversations, mobile conversation. You keep on walking. Do not sit, do not lie. You just walk and talk to someone over phone, right? The other way you can take exercise that when you are watching video, suppose you are watching this video, try to walk. So when you are watching a video, you'll walk. When you are talking on phone, you should walk. This is how you can uh, keep your diabetes under control. You can also get your diabetes under remission. What is it? Diabetes cannot get cured, but it can go into remission. How? Suppose you have food, a lot of sugar, still it doesn't go above the level 5.7. And if you test the hemoglobin level, that is HbA1c, if you find that the number is less than 6.5, then or 5.7, you don't have diabetes. So it means you had diabetes, now you don't have diabetes anymore. But very quickly, if you do not comply with the rules and regulations, if you do not walk, if you do not uh, follow lifestyle, then easily you can get the diabetes back. So what's the difference between someone who has diabetes in remission and the other one who has never had diabetes? The thing is that one who has never had diabetes will take a long time to get the syndrome, right? But if you once had diabetes and you now keep it under control and it is fine, like a normal person, your blood sugar level doesn't go higher than 5.7. But the thing is that when you already had diabetes and then got it into remission, once again you can get diabetes back if you don't take care of yourself properly. So how does the what is the main cause of diabetes? There's recent studies. It says you have intestine alkaline phosphatase, IAP, intestine alkaline phosphatase. When you have 7 or less than 7 IAP, that is IAP deficiency, in intestinal alkaline phosphatase deficiency. What it means is that if your IAP, intestinal alkaline phosphatase, less than 7, you will develop diabetes. If it is more than 7 or even 7, you will not develop diabetes. Even when you are fat, even when your health is not good, even when you are not that much healthy, problem with some disease or whatever. So I found a lot of patients, a lot of men, they seem to be diabetic patients. You may find that they have developed diabetes. But when you check their blood sugar level, you'll find that they don't have diabetes. It's because the IPA, intestinal alkaline phosphatase, level is higher than 7 or at least 7. Right? So someone who is fat may not have diabetes, someone who is ill health may not have diabetes, but one who is healthy, one who doesn't have belly fat, may have his weight under control, everything is fine, still he may develop diabetes. So what's best is to have turmeric, curcumin, right? Turmeric, if you smash into powder, it becomes curcumin, right? So when you have it, sometimes regularly, you may have some on your water, you may dissolve it in water and you can drink. It doesn't get tasty, but for better health, you can have it. You can drink it with water. So curcumin, that is very, very helpful. If you have curcumin, it happens that your alkaline, that is intestinal alkaline phosphatase, goes higher than 7. Right? This is how you can beat diabetes. When I had diabetes 4.5 years ago, I caught it. It was 34.8. That's horrible. Even at one point, I found that I saw little less. When I saw someone at a distance, I couldn't see his face, something blurry. So at the time, I probably had 45 points. So it's possible, even when you have 45 points, still you may be all right. You may not get unconscious. But if you get less than 2.77, you may get unconscious. This is terrible. So even when you have blood sugar level kind of 45 points, still you may not get unconscious. But if it is less than 2.77, you may get unconscious. So what is important is that you should have glucagon, that is a kind of injection with liquid full of sugar. So if someone gets the blood sugar level less than 2.77, and if he gets unconscious, he can't have sugar anymore, right? That's why when you can't make him wake up, what you should do is you should push an injection, that is glucagon, that you keep at home, like the fire extinguishing machine, right? So as I told you, the if it is less than 3.88, it means you have hypoglycemia, less than 3.88, but not less than 2.77. That is hypoglycemia. And if it is even less than 2.77, then what happens? You may get unconscious and you may not get back to your senses. Right? And if it is 3.88 plus and less than 3.57, you're quite normal. If your HbA1c is below 5.7, then you have no problem with diabetes. If it is more than 5.7, right, that is pre-diabetes. And if it is more than 7 points, you have developed diabetes. But to be more confirmed, what you should do is you have 75 grams of sugar, and after 2 hours, if you get your blood sugar level checked, if you find that it's more than 11, that is 11.1 or plus, then you have developed diabetes. And if you have HbA1c, and if it is more than 6.5, it means you have developed diabetes. So this is horrible, right? So diabetes is not a disease, a metabolic syndrome. When you have it more than 6.1, it will harm your body. The more, the worse for you. That's it for now. Thanks for watching.